Hi, my name is Dr. Lori Kaylee. I am a functional medicine practitioner and I help women who have thyroid conditions to reverse their thyroid conditions naturally so that they can experience optimal health and get their lives back. Today, I want to talk about a client that I was working with and an infection that she had. And if you've listened to any of my previous videos or have read some of my blog posts, that it's really important to get to the root cause of the problem. And one of the very common root causes when someone has Hashimoto's is hidden infections. So this 36-year-old female came to me with thyroid symptoms, and she also was experiencing chronic bloating, gas, belching, abdominal distension, chronic intermittent diarrhea and constipation, and she had abdominal pain and discomfort as well. So I looked at her health history and previous medical records, and from that I suspected that she had SIBO, and SIBO is small intestinal bacterial overgrowth. What will happen is bacteria that should not be in your small intestine will be present. So that bacteria will come from the large intestine into the small intestine. So you should have very little bacteria in the small intestine. So when it migrates there, you will experience these symptoms. So she got the test that I had recommended, and the test to diagnose is a hydrogen methane breath test. So she got this done. It came back positive. I had then talked to her about her treatment options, and one treatment option is the use of antibiotics. However, I typically don't recommend this option because studies have shown that there will be a reoccurrence of SIBO within a year. So the other option is to use natural botanicals and herbs, which seems to work very, very well. There is a lot of success with this method, and there are not as many reoccurrences. And you should also follow a SIBO diet when you are trying to get rid of SIBO. So after 6 months of following my treatment protocol, she had another breath test done to make sure that we took care of the SIBO infection. And her breath test was negative. And after a year, she is still doing great. She got rid of these symptoms, and I'm in touch with her every so often. And the last time we talked, which was about a month ago, she said she was doing great. So if you are having these symptoms, if you are having a hard time figuring out what's going on, please feel free to get in contact with me. I offer 30-minute free consultation, so I'm going to put that link in the description of this video. And if you have any questions or comments, please just leave them in the comments section, or just please feel free to message me privately, and I would love to hear from you. Thank you so much for watching.